Hey guys, it's B. Welcome back to my channel, or if you're new here, welcome to my channel. So we're going to talk about something that almost nobody explains properly, how to become a nurse in the UK without going to university full-time and drowning yourself in debt. And not just that, but how to do it starting at 17. Even if you're not in school, even if you're behind, even if everyone around you is shouting about UCAS and personal statements and student finance like it is the only path in the world. This video is the full truth, not the sugar-coated version, not the college marketing version, not the just do degree version. I'm talking about the real route, the apprenticeship route, the T-level route, the nitty-gritty, the emotional load, the physical toll, the politics, the burnout, the moments that break you and the moments that make you. The stuff that no one tells you until you're already in scrubs, leaning against the wall at 4 a.m, thinking, what the hell just happened tonight? This is the video I wish someone made years ago. So let's get into it. Start with the biggest myth in the UK. You have to go to university to become a nurse. No, you don't. The Nursing and Midwifery Council, the NMC, the people who literally decide who is and isn't a nurse, do not care whether you're trained through a traditional university degree or a registered nurse degree apprenticeship. Both routes lead to the exact same qualification, the same NMC pin, the same job title, same responsibilities, same pay, same progression, same everything. No employer can tell the difference, no patients can tell the difference, no colleague can tell the difference. The apprenticeship route is not a shortcut, it's not a lesser route, it is not a loophole. It is just a different way of getting there, one that lets you earn while you learn, avoid debt, and build real experience from day one. And honestly, for a lot of people, especially people who don't thrive in traditional academic environments, it's the better route. So here's the exact ladder you climb to become a nurse without going to uni. I'm going to lay it out cleanly, simply, and realistically. Step 1, get a level 3 qualification. You need one of these: a T level in health, a level 3 health and social care, or access to HE health, but that's usually you have to be 19 plus. For me, at 17, the T level or health and social care is the route. Then you have to get a healthcare support worker job, age 17 to 18. This is after you do your course. This is your foot in the door. You learn the basics, you get paid, you build confidence, and you get real experience. Then you do a nursing associate apprenticeship, age 18 plus. This is a level 5 apprenticeship. You become a registered nursing associate. This is a real regulated clinical role. You're not a student anymore, you're a professional. Then you do a registered nursing degree apprenticeship. This is the step that makes you a nurse. It is a level 6 apprenticeship. It is the same level as a degree. You rotate through different areas, you study part-time, you work part-time, and at the end you become a registered nurse. Then you specialise. Once you're an RN, you can specialise in A&E, ICU, neonatal, mental health, community, oncology, theatres, paediatrics, district nursing, school nursing, GP nursing, and more. Your career becomes a tree with endless branches. So the timeline realistic: 17 you start at T level, then at 18 you get a HCSW job, then 19 21 you do a nursing associate apprenticeship, then you do a registered nursing apprenticeship, then you become a fully qualified nurse, and then you specialise. You're in your mid-20s with no debt, years of experience, a stable career, and a powerful professional registration. That's powerful. Now this is where we go deep into the T level. I'm going to tell you every unit explained, every topic broken down, what lessons you are actually like, how teachers teach, what year 1 versus year 2 looks like, how the academic side really works, the hidden expectations, the workload, the stress points, the reality of being 17 in a clinical course. This next chapter will be massive, so I'm going to break it down for you. Let's get started with that. Alright, let's get into T-level health properly, not the surface level explanation, not the it's like 3A levels nonsense. I'm actually talking about what you actually study, what the lessons feel like, what the workload is, what the teachers expect, and how the academic side really works. Because if you're thinking about doing this course, you deserve the full truth, because I certainly am. The T-level in health is a 2-year full-time level 3 qualification that's designed to prepare you for real clinical work. It's not a soft option, it's not a backup plan, it's not college light. It's basically the closest thing you can get to pre-nursing training without actually being in the NHS. The academic side is split into 3 big chunks. Number 1, core content. That's the foundation. Then number 2 is occupational specialism. That's the nursing focus part. And then number 3 is the employer set project, which is a huge assess project. And all of this is mixed with placement, which we will cover later. So year 1 is where they build your foundation. This is very much the hardest year. This T level is also not the scary, but the one that people drop out of the most because they struggle with. But yeah, year 1 is where they build your foundation. This is the year where you learn the science, the theory, the laws, the ethic, the communication skills, everything you need before you ever step foot into a clinical environment. So we're going to break down the core units. So the first unit is working within the health and science sector. This unit teaches you how the NHS works, how private healthcare works, how multidisciplinary teams work, what different roles do, how communication flows in healthcare, and why teamwork literally saves lives. This is where you learn the language of healthcare, the terms, the structure, the culture. Then you've got Unit 2, which is Health, Safety and Environmental Regulations. This is a unit that keeps you and patients alive. You learn manual handling, fire safety, COSHH, RADDOR, lone working, risk assessments, hazard identification, how to report incidents. This is the stuff that stops accidents, injuries and lawsuits. Then you've got Unit 3, Managing Information and Data. This one surprises people. You learn how patient records work, how confidentiality works, GDPR, data protection, how to document correctly, why documentation is a legal requirement. This is where you realise nursing is 50% communication and 50% documentation. Then you've got Unit 4. This is the good scientific and clinical practice. This is where you learn infection control, aseptic technique, hand hygiene, PPE, how infections spread and why mistakes kill people. This is the unit that makes you paranoid but in a good way. And Unit 5, Core Science Concepts. This is the science unit. You learn cells, tissues, organs, body systems, homeostasis, disease processes, and basic microbiology. This is the foundation for understanding illness. This is why they want you to have a science subject, which you pass in your secondary. Then in Unit 6, you have the human body, which is the anatomy and physiology. This is the big one. You learn the cardiovascular system, the respiratory system, the digestive system, the nervous system, the musculoskeletal system, the endocrine system, the renal system, and the reproductive system. You will learn how the body works, how it fails, how to recognize deterioration. This is the unit that makes you feel like you're actually becoming a healthcare professional. Then you've got infection prevention and control. This is Unit 7. You learn chain of infection, transmission routes, cleaning protocols, decontamination, outbreak management, why infection control failures kill people. This is the unit that makes you judge everyone's hand washing technique. Unit 8 is your safeguarding unit. This is one of the most emotionally heavy units. You learn types of abuse, signs of abuse, how to escalate concerns, mental capacity, consent, deprivation of liberty, and legal frameworks. This is the unit that changes how you see the world. And then Unit 9, which is the person-centered care. This is where you learn how to talk to patients, how to build trust, how to support dignity, how to handle difficult conversations, how to work with families, how to support emotional needs. This is the heart of healthcare. Now we're going to go into Year 2. So Year 2 is where things get real. This is where you specialise in supporting the adult nursing team, the pathway that leads directly into nursing apprenticeships. So Specialism Unit 1 is supporting the adult nursing team. You learn how adult nursing teams work, how to support RNs and nursing associates, how to recognise deterioration, how to escalate concerns, how to maintain dignity, how to support personal care, and how to work safely in clinical environments. This is the unit that prepares you for the real world. Oh my god, so sorry. Then you've got Specialism Unit 2. This is clinical tasks and skills. So depending on your placement and college, you may learn observations, manual blood pressure, pulse, respirations, temperature, urinalysis, peak flow, blood glucose monitoring, basic wound care, infection control procedures, bed making, and basic life support. These are the skills that make you employable. And then you've got Specialism Unit 3, Communication and Professionalism. You learn how to communicate with patients, how to communicate with staff, how to handle conflict, how to escalate concerns, how to maintain boundaries, and how to behave professionally. This is the unit that turns you from a student into a future clinician. Then you've got Specialism Unit 4, which is Supporting Patients' Needs. You learn nutrition, hydration, mobility, pressure area care, personal hygiene, continence care, emotional support, end-of-life care. This is the unit that teaches you the reality of patient care. So now let's talk about what the lessons actually feel like, because this is the part that no one really explains. So the first one is it's not like school. You're treated more like adults. Teachers expect independence. You're responsible for your own learning. Lessons are long. You might have 2-hour theory blocks, 3-hour practical sessions, full day employer-set project workshops. It's intense. Teachers expect you to think like a healthcare worker, not like a GCSE student. You're expected to ask questions, think critically, reflect, apply theory to practice. You will do group work. A lot of it. Healthcare is teamwork, group work is training for real life. You will do practical sessions. These might include taking observations, practicing communication, role-play scenarios, infection control drills, manual handling practice. And you will be challenged. Teachers will push you. They want you to be safe, competent, and confident. Let's be real, the workload is heavy. You will have weekly assignments, long written tasks, practical assessments, placement logs, reflective journals, employer-set project work, revision for exams. It's not impossible, but it's not easy. You need organisation, time management, resilience, and support. This course prepares you for nursing, and nursing is demanding. There are things that no one tells you, but I will. So you are expected to behave professionally even at 17. You're expected to show maturity, especially on placement. You're expected to communicate clearly, no mumbling, no shrugging, no hiding. If you're struggling with something, tell them they can help you. They're there to help you. You're expected to reflect. Reflection is a huge part of healthcare. And you're expected to take responsibility for your learning, for your behaviour, for your growth. Now that we've covered the academic side of the T-level, let's talk about what it's actually like to be a T-level health student, because the truth is, the day-to-day reality is completely different from what colleges tell you. This isn't like school, it isn't like GCSEs, it isn't like a normal college course. This is a course that expects you to act like a future healthcare professional, even when you're still technically a kid. So let's walk through a realistic day, not the polished version, the real version. 7 a.m, you wake up tired. You're not exhausted like a night shift nurse, but you're tired because this course is full-time. You're juggling long lessons, assignments, placement, travel, and life. You're 17, but you're living like a trainee adult. You grab breakfast, or you don't because you're rushing, and you head out. 8:30 a.m, you arrive at college. You walk into the building and immediately see people in scrubs, people with lanyards, posters about safeguarding, posters about infection control, teachers who look like they've already lived 3 years. Or 3 lives. It feels different from school, more serious, more grown up. 9 a.m. is your first lesson, anatomy and physiology. This is a long session. You're learning how the heart works, how the blood works, how oxygen moves, how diseases affect the body. Your teacher might be a former nurse, a former paramedic, a former healthcare assistant, a science specialist. They teach differently from school teachers. They expect you to take notes, ask questions, think critically, apply knowledge. You are not spoon-fed. 10:30 a.m, break. You and your classmates go to the cafe, you talk about placement, teachers, how tired you are, how confusing the last lesson was, how you're scared for your first clinical shift. You bond quickly because you're all in the same boat. 10:45 a.m. is the second lesson, safeguarding. This one hits emotionally. You learn about abuse, neglect, domestic violence, mental capacity, consent, and real case studies. Some lessons are heavy, some make you think about your own life, some make you uncomfortable in a necessary way. 12:30, lunch. You decompress, you laugh, you scroll your phone, you talk about the weird things you saw in placement, you talk about the patients who made you smile, you talk about the ones who scared you. This is where friendships form. 1:15 p.m, practical session, clinical skills. You go into a simulated ward. There are hospital beds, mannequins, PPE, blood pressure cuffs, urine dipsticks, gloves, and aprons. You practice taking observations, manual blood pressure, communication, bed making, infection control, and basic life support. You feel awkward at first, everyone does, but you get better eventually. At 3 p.m, you debrief. Your teacher asks what went well, what didn't, what would you do differently. Reflection is a huge part of healthcare. You learn to think like a clinician. 3:30 p.m. is the end of the day. You're tired, your brain is full, you still have assignments to do, you still have placement logs to fill in, you still have life to deal with. This is the reality. Let's zoom out. Here's what a typical week looks like. So Monday is theory day. Anatomy, physiology, infection control, safeguarding, and health and safety. You take notes until your hand hurts. Tuesday is practical day. Clinical skills, communication practice, roleplay scenarios, and manual handling. You feel like you're actually training for the job. Wednesday is employer-set project work. This is a huge part of the course. You work on research, reports, presentations, problem-solving tasks. It feels like real healthcare work. Thursday is placement, some weeks. Not all weeks. You go into care homes, hospitals, community settings, GP surgeries, and mental health services. You learn more here than anywhere else. Then Friday is reflection and tutorials. You talk about what you learned, what scared you, what confused you, what you want to improve. This is where you grow. The thing that no one tells you is that the first month feels overwhelming. You're learning new vocabulary, new skills, new expectations, new responsibilities. You feel like you're pretending to be an adult. The first placement is terrifying. You worry about saying the wrong thing, doing the wrong thing, looking stupid, being judged, hurting someone. Everyone feels this way. You grow faster than you expect. By month 3, you're more confident, more mature, more capable, more aware, and more resilient. You start to feel like you belong. You will have emotional days. Some lessons hit hard. Some placements hit harder. Some patients remind you of people you love. Some situations stay with you. This is normal. And you will have breakthrough moments. Moments where you think, I can do this. I'm good at this. This is what I'm meant to do. These moments keep you going. Let's talk about the social aspect and the people. So your classmates, they become your people. You bond fast because you see heavy things, you learn emotional content, you share placement stories, you support each other. It is a very unique environment. There will be drama. It is a group of teenagers, mostly freshly out of secondary school. There will be arguments, cliques, people who don't pull their weight, people who take things too seriously, people who don't take things seriously enough. It's normal. I've learned my lesson. I am going to stay away. You learn who's serious and who's not as well. Some people drop out, some people switch courses, some people realize healthcare isn't for them, and that is okay. You find your confidence. You learn to speak up, ask questions, advocate for yourself, and advocate for your patients. This is huge. So here's what students struggle with the most. Time management. Assignments plus placement plus life equals chaos. Emotional content. Safeguarding hits hard. End of life care hits harder. Confidence, you feel like you're faking it at first. Placement anxiety, everyone gets nervous and the workload is heavy but manageable with support. And you're not alone, you have teachers, tutors, placement supervisors, classmates, pastoral support, safeguarding officers. If you struggle, there is help. It's now we're getting into the part of the T-level that nobody warned you about. The assignments, the exams, the employer-set projects, the practical assessments, the grading system, the hidden rules, the deadlines, the stress, the reality. This is the academic engine of a T-level, and if you understand it properly, you'll survive it. If you don't, it can hit you like a truck. So let's start with the thing you'll spend the most time on. Assignments. These are not GCSE style worksheets. These are not copy the textbook tasks. These are not write a paragraph jobs. T-level assignments are professional level written work, and they expect you to think like a healthcare worker. So here's what you'll write. You'll write written reports. These are long. You'll write reports on safeguarding cases, infection control failures, anatomy and physiology topics, communication breakdowns, ethical dilemmas, health and safety scenarios. A typical report might be 1,500 to 2,500 words, with references, with diagrams, with analysis, with evaluation. This is where you learn to write like a professional. You will also do case studies. These are fictional scenarios based on real healthcare situations. For example, a 78-year-old patient with dementia refuses personal care. What do you do? What laws apply? What communication strategies would you use? How would you escalate concerns? You are expected to apply theory, use legislation, use safeguarding frameworks, show empathy, and show professionalism. This is where you learn to think like a clinician. And then you'll do research assignments. You will research topics like diabetes, COPD, pressure ulcers, infection outbreaks, mental capacity, communication barriers. You will learn how to find reliable sources, evaluate evidence, reference correctly, and present findings clearly. This is where you learn academic discipline. And then reflective journals. Reflection is huge in healthcare. You will write about what you learned, what you struggle with, what scared you, what you want to improve, what you do differently. This is where you grow emotionally and professionally. Presentations, yes, you will stand up and talk. You might present on disease, a safeguarding case, a communication strategy, a clinical skill, a placement experience. This builds confidence. And then group projects. You will work with people who don't do their part, don't do too much. They do too much, they don't show up, they take over, they don't communicate. This is training for real healthcare homework. There are two big exams in T-level, Core Paper 1 and Core Paper 2. These cover everything from year 1. Let's break them down. So, Core Paper 1 is the science and clinical side. This includes anatomy and physiology, infection control, health and safety, clinical practice, and scientific concepts. This is the heavy science paper. Core Paper 2 is the professional side. This includes safeguarding, communication, data protection, person-centered care, professional behaviours, and legislation. This is the thinking like a healthcare worker paper. The exam includes multiple choice, short answer, long answer, scenario-based questions, and applied knowledge questions. You're not just memorizing facts, you're applying them. And the exams are long, they're intense, and they're mentally draining, but they're possible if you revise properly. This is the part of the T-level that shocks people. The Employer Set Project, the ESP, is a massive multi-week assessment that simulates real healthcare work. It includes research, reports, presentations, problem solving, practical tasks, written tasks, group work, independent work. It's like doing a mini job in healthcare. So let's break it down. So phase 1 is the brief. You are given a scenario like a care home has had a rise in pressure ulcers. You must investigate the causes, propose solutions, and present your findings. Or a hospital ward has had an infection outbreak. You must analyse the failures and create an action plan. This is where you panic for 10 minutes and then you get to work. Phase 2 is the research. You gather information on legislation, best practice, clinical guidelines, risk factors, and prevention strategies. This is where you learn to think like a professional. Phase 3 is the written tasks. You write reports, action plans, risk assessments, and valuations. These are long and detailed. Phase 4 is the practical tasks. You might demonstrate infection control, demonstrate communication, demonstrate manual handling, demonstrate observations. You are assessed on safety, technique, communication, and professionalism. And then phase 5 is the presentation. You present your findings to teachers, assessors, and sometimes external professionals. This builds your confidence. And phase 6 is your reflection. You reflect on what you learned, what you changed, what challenged you, and what you're proud of. This is where you grow. The assessments that test your clinical skills, you might be assessed on taking observations, manual blood pressure, infection control, communication, bed making, basic life support, and mobility support. You are assessed on safety, accuracy, professionalism, communication, and technique. These assessments feel like mini OSCEs, clinical exams. So how grading works, your final grade is based on core exams, employer set project, occupational specialism assessments, and placement performance. You can get pass, merit, distinction, and distinction star, which is the highest grade you can get. This specialism is weighted heavily because it shows your clinical ability. There are hidden rules of passing the T-level. There are things that no one tells you. So attendance matters. If you miss too much, you fail. If you behave unprofessionally on your placement, you fail. If you don't reflect, you don't grow. You need to speak clearly and confidently confidently. Communication does matter. Organisation matters. You cannot wing the course. And asking for help matters. People who stay silent do end up struggling. So here's the truth. The T-level workload is heavy but survivable if you're smart. Start assignments early. Do not wait until the night before. Break tasks into chunks. Small steps equals less stress. Use your teachers. They want you to pass. Use your classmates. Study groups help. Use templates. They save time. And don't aim for perfection. Aim for progress. Alright, this is the part of the T-level that changes you. Placement. This is where everything you learn in the classroom suddenly becomes real. This is where you go from student to future healthcare worker. This is where you see things that you can't unsee. This is where you grow faster than you thought you ever could. And this is the part colleges never explain properly, so I'm going to. Placement isn't random, it's structured, but it's also chaotic in its own way. So here's how it usually works. You get your placement allocation. Your college will place you in one or more of the following: a care home, a residential home, a supported living service, a GP surgery, a hospital ward, if the college has NHS partnerships, a community health team, or a mental health service. Most T-level students start in care homes because they're easier to place students in, they're safer for beginners, they're slower paced, and they teach the fundamentals. Hospitals, they often come later. Then you get your rota. Your rota might be 1 day a week, 2 days a week, block placement, so 2 weeks full time, or a mix of both. You must complete, though, at least 315 hours, but many colleges push for more. You get a placement mentor. This is usually a senior carer, a healthcare assistant, a nurse, or a team leader. This is your guide, your supervisor, your assessor. Some mentors are amazing, some are not. We will get into that later. You will get a placement workbook. This is your Bible. It includes tasks, skills, reflection prompts, attendance logs, supervisor sign-offs. If you lose it, you will cry. So let's walk through your first day, honestly. So you wake up nervous, you're scared, you're excited, you're overthinking everything. You worry about saying the wrong thing, doing the wrong thing, looking stupid, being judged, hurting someone, not knowing what to do. This is normal. Every single student feels this way. You arrive early. You walk in wearing your uniform, your lanyard, your ID badge, shoes that you hope are comfortable, and you feel like a fraud. You're not. You're learning, that's it. Then you meet the staff. Some will be warm, some will be blunt, some will be too busy to talk, some will be curious about you, some will forget you're coming. Healthcare is unpredictable. Then you get a tour. You're shown the staff room, the medication room, you won't go in, the laundry, the kitchen, the residence rooms, the bathrooms, the hoists, and the PPE stations. It is overwhelming. Then you shadow someone. You follow a staff member around and watch them. Watch them support personal care, help with feeding, talk to residents, do observations, write notes, handle challenging behaviour, and manage time pressure. You realise how much care workers actually do. And then you do your first task. It might be making a bed, talking to a resident, helping someone to the dining room, fetching equipment, helping with drinks, observing personal care. Your hands shake, your voice shakes, your brain goes blank. This is normal. And you go home exhausted. Your feet hurt, your back hurts, your brain hurts, you're emotionally drained, but you also feel proud. So let's break down the tasks, honestly. So the first one is personal care. So this is the big one. This includes washing, dressing, toileting, continence care, changing pads, supporting dignity, maintaining privacy. This is the part people fear most and the part that teaches you the most. Then you got feeding and hydration. You might help residents eat, encourage fluids, monitor intake, support special diets, report concerns. This teaches you patience and communication. And then you've got mobility support. You might assist with walking, use hoists, use stand aids, support transfers, prevent falls. This teaches safety and teamwork. And then observations, if allowed. Depending on the placement, you may take pulse, take respirations, take temperature, take manual BP, do urinalysis, do blood glucose monitoring. This teaches clinical skills. Communication, you will talk to residents, families, staff, handle confusion, distress, dementia, and handle challenging behaviour. This teaches emotional intelligence. Documentation, you might write basic notes, record fluid intake, record food intake, record mobility support, record observations. This teaches accuracy and responsibility. This is the part no one tells you. Staff expect you to be willing to learn, not perfect, just willing, ask questions. Silence is dangerous in healthcare. Use initiative, don't stand around waiting. Be respectful to staff, residents, and families. Be reliable, show up, be on time, do your best. Be professional, even when you're tired, even when you're stressed, even when you're overwhelmed. So, let's be honest. Personal care is intimate, emotional, and confronting. Dementia is unpredictable, heartbreaking, and confusing. Death, you may experience it, it changes you. Confidence, you feel like you know nothing, that's normal. Emotional overload, some days hit hard. Time pressure, healthcare is fast. About this shapes you, so the first time a resident remembers your name, you feel proud. The first time someone trusts you, you feel responsible. The first time you comfort someone, you feel connected. The first time you see someone decline, you feel helpless. The first time you lose someone, you feel grief, even if you didn't expect to. The first time you realize you made a difference, you feel everything at once. Every student has one bad shift. It might include a resident shouting, refusing care, falling, crying, passing away, staff being stressed, you feeling overwhelmed, useless, or scared. You go home drained, but you learn from it. The moment that makes everything worth it. It might be a resident smiling at you, a staff member praising you, a family member thanking you, you doing a task independently, you realizing you're good at work, you feeling like you belong. This is the moment you think, I can do this, I was meant for this.
So, there is a change of scenery, but that's okay. Shirt's a bit wrecked, wrinkled, a little bit messy, that's what I mean. But yeah, change of scenery, so let's get back into it. Now we're going to step into the part of the journey where everything changes. The Nursing Associate Apprenticeship. This is the moment you stop being a student on placement and start being a paid member of the clinical team. This is the moment you get your first uniform with your job title on it. This is the moment you realise you are responsible for real people, real care, real consequences. And this chapter is going to tell you everything. The good, the bad, the stressful, the emotional, the political, the stuff no one warns you about, and the stuff that makes you fall in love with the job. Clear this up properly. So a Nursing Associate, NA, is a registered healthcare professional regulated by the NMC. It is a role that sits between a healthcare assistant and a registered nurse. A clinical role with real responsibility, a stepping stone to becoming a registered nurse. You are not a student, you are not an assistant, you are not a volunteer, and you are not a trainee who watches. You are a professional. You have a PIN number, a scope of practice, accountability, and legal responsibility. This is the first time you're truly in the job. The Nursing Associate Apprenticeship is 2 years long, paid, usually band 3 or band 4 depending on the trust, part work, part study, part clinical placements, part academic learning, a mix of university days and ward days. So you're employed by an NHS trust, a GP practice, a community team, and a mental health service. You are paid for your shifts, your study time, your placements. You are a real employee. Your working week, a typical work week might look like 3 days on the ward, 1 day at uni, 1 day at placement, or 4 days in the ward, 1 study day, or block placements, block study weeks. It varies by trust. You have uni days. These include lectures, seminars, skill labs, assignments, exams, reflection sessions. You study anatomy and physiology, pharmacology, communication, professional practice, mental health, long-term conditions, acute care, public health, safeguarding, clinical skills. It's like a mini nursing degree. You rotate through medical wards, surgical wards, community teams, mental health, learning disability services, GP surgeries, theatres, outpatients, and emergency care. This is where you learn the breadth of healthcare. This is the part people misunderstand a lot. You're not just helping, you're not just shadowing, you're not just assisting, you are doing real clinical work. So your day could look like observations constantly. You take blood pressure, pulse, respirations, temperature, oxygen saturation, blood glucose, NEWS2 scoring. You learn to spot deterioration. Personal care, still part of the job. You support washing, drying, toileting, dressing, continence care, pressure area care. This is the foundation of nursing. Wound care, you might assist with dressings, clean wounds, monitor healing, document changes. This is where you learn clinical precision. Then you've got catheter care. You learn catheter hygiene, monitoring output, recognizing infection, supporting dignity. This is intimate, but it's essential. And then you've got mobility support. You assist with walking, use hoists, use slide sheets, prevent falls, support rehabilitation. This teaches homework and safety. Communication, you talk to patients, families, nurses, doctors, physios, OTs, and social workers. Communication is half the job. And then you've got documentation. You write care notes, observation charts, fluid charts, risk assessments, and handover notes. Documentation is legal evidence. Then you've got escalation. You learn when to call a nurse, when to call a doctor, when to call the crash team, when to escalate concerns. This is where you learn clinical judgment. And this is the part which no one prepares you for. You see people at their worst. You see pain, fear, confusion, anger, grief, trauma. It's heavy. You see people at their best. You see strength, resilience, love, gratitude, hope. It's beautiful. You lose patients. Even if you weren't their nurse, it hits you. You remember their face, their voice, their stories, their family. You carry it with you. You get attached. You're human. You care. You connect. And sometimes that hurts. You grow emotionally. You learn boundaries, empathy, resilience, professionalism, self-awareness. The job changes you. Now let's be honest, some nurses will love you. They will teach you, they will support you, they will lift you up. Some nurses will be threatened. They will see you as competition. They will test you, they will underestimate you. Some HCAs will resent you. They will think you're moving up too fast. Some doctors won't know what your role is. They'll ask you to do things outside your scope. You must learn to say no. You must protect your scope of practice. You are accountable. You must know your limits. Things that no one else tells you are, you gotta ask questions always. Silence is very, very dangerous if you don't know what you're doing and you end up being forced to do something which you don't know how to do. you have to say no and always ask questions so you know what you're doing. Never guess. Guessing kills people. Document everything. If it's not written, it didn't happen. Speak up. You are part of the team. Protect your breaks. You do need your breaks. Don't take things personally. Healthcare is stressful. Learn to say I don't know. It's safer than pretending. Learn to say that's outside my scope. Protect yourself. So, transitioning from a student to professional is the hardest part. You feel like an imposter. Everyone does. You feel pressure because now you're accountable. You feel proud because you're finally doing the job. You feel scared because mistakes do matter. You feel capable because you've trained for this. And you feel changed because you've grown. The nursing associate role fills the gap between HCAs and RNs. Support safe staffing, improves patient care, builds future nurses, and creates progression routes. It is a very powerful stepping stone. So once you qualify as a nursing associate, you can apply for a registered nursing degree apprenticeship. You can get prior learning recognised, shorten your training, become a registered nurse, specialise and progress. This is the ladder, this is the route, this is how you become a nurse without uni. So, now we're stepping into the final major stage of becoming a nurse without going to for uni full time, the registered nurse degree apprenticeship. So this is the moment everything you've done, the T-level, the healthcare support worker job, the nursing associate apprenticeship, all of it comes together. This is where you train as a nurse while being paid. This is where you rotate through every major area of healthcare. This is where you learn the full scope of nursing. This is where you face the hardest challenges and the biggest growth. And I'm going to tell you everything, the good, the bad, the stressful, the emotional, the political, the stuff no one warns you about, and the stuff that makes you realise you are becoming a nurse. So let's clear this up properly. The registered nurse degree apprenticeship is a level 6 qualification, equivalent to a full nursing degree, fully funded by your employer, delivered part-time while you work, usually 3 to 4 years long, a mix of work, study and placements, a route that leads to becoming a registered nurse. You end with a nursing degree, an NMC pin, a full RN status, a 0 student debt, and years of clinical experience. It is the same qualification as university, just delivered differently. So this is where things get intense. Your week is split into work shifts, which is your contracted job. You might be working 12-hour shifts, days, nights, weekends, bank holidays. You're a real employee. University days, usually 1 day a week, but sometimes block weeks. You attend lectures, seminars, skills labs, tutorials, and assessments. Placement rotations, you rotate through A&E, ICU, theatres, community, mental health, children's services, medical wards, surgical wards, outpatients, and GP practices. This is where you learn the full scope of nursing. Independent study, this is the part that breaks people. You have to study after shift, on days off, on weekends, when you're exhausted. It's hard, but it's doable. So the RN apprenticeship covers everything a university nursing degree covers. So the full academic breakdown, so it's anatomy and physiology, advanced. You go deeper than T-level. Cardiovascular system, respiratory system, neurological system, the endocrine system, the renal system, the gastrointestinal system, and the musculoskeletal system, and the immune system. You learn how diseases affect the body and how to respond. Pharmacology, the scary one. You learn how medications work, side effects, interactions, contraindications, safe administration, calculations, IV therapy basics. This is the unit everyone stresses about, and for good reason. Clinical skills, advanced. You learn wound care, catheterization, NG tube care, PEG feeding, venipuncture in some trusts, not all, cannulation in some trusts, not all, ECGs, oxygen therapy, fluid balance, pain assessment, NEWS2 escalation. This is where you start feeling like a real nurse. Then you do communication and professionalism. You learn breaking bad news, de-escalation, conflict management, working with families, working with MDTs, professional boundaries, ethical decision making. This is the emotional side of nursing. Mental health and well-being, you learn anxiety, depression, psychosis, dementia, delirium, trauma, suicide risk, self-harm risk, capacity and consent. This is essential for every nurse, not just mental health nurses. Public health, you learn health promotion, disease prevention, social determinants of health, health inequalities, community interventions. This is the big picture side of nursing. And then law and ethics, you learn the NMC code, the duty of care, negligence, consent, confidentiality, safeguarding, Mental Capacity Act, and deprivation of liberty. This is the legal backbone of nursing. And then research and evidence-based practice, you learn how to read research, how to evaluate evidence, how to apply evidence to practice, how to write academic papers. This is the academic side of nursing. Now, this is where the apprenticeship becomes intense. You rotate through every major area of healthcare. So let's break it down. So A&E, accident and emergency. Fast, chaotic, adrenaline-filled, emotionally intense. You see trauma, heart attacks, strokes, overdoses, mental health crisis, children, elderly, everything. You learn to think fast. ICU, which is intensive care. It's quiet, but it's very intense. Machines everywhere, critically ill patients. You learn ventilators, drips, monitoring, complex care, and family support. You learn precision. Then there's theatres. They're calm, they're structured, they're technical. You learn scrub rolls, circulating rolls, aseptic technique, surgical instruments, and anaesthetic support. You learn discipline. Community nursing. You visit patients' homes. You learn wound care, palliative care, diabetes care, medication support, and holistic care. You learn independence. Mental health is emotionally heavy, deeply human. You learn de-escalation, trauma-informed care, crisis support, and therapeutic communication. You learn empathy. Medical wards. Busy, chaotic, foundational. You learn everything all at once. This is where you become competent. Surgical wards, fast turnover, post-op care, pain management. You learn observations, wound care, mobility support, and discharge planning. You learn efficiency. And this is the part no one prepares you for. You will cry. Everyone does. After shifts, in the shower, in the car, in the staff room, at home. It is normal. You will doubt yourself. You'll think, am I good enough? Can I do this? What if I make a mistake? This is part of the journey. You will see trauma, real trauma, human trauma, the kind that stays with you. You will see beauty, moments of kindness, moments of strength, moments of connection. You will grow emotionally, professionally, personally. You become someone stronger. Now let's be real, the RN apprenticeship is hard. You're juggling full-time work, university, placements, assignments, exams, and life. You will be tired, stressed, overwhelmed, proud, determined. It's intense, but it's worth it. Let's talk about the stuff no one warned you about. Some staff will treat you like a student, even though you're an employee. Some staff will treat you like a nurse, even when you're not ready yet. Some staff won't understand your role. You will have to explain it. So you must protect your scope of practice. Never do anything you're not trained for. You must advocate for yourself, because no one else will. There are moments in the RN apprenticeship that stay with you forever. The first time you save someone, you never forget it. The first time a patient thanks you, it does hit deeply. The first time you handle a crisis calmly, you realise how far you've come. And the first time you feel like a real nurse, it is very emotional. Now this is the final step. You finish the apprenticeship, you pass your assessments, you complete your hours, you submit your portfolio, you apply to the NMC, you get your PIN, and suddenly, you're a nurse. A real one, a registered one, a professional one. You did it. Okay, this is the chapter where we stop talking about the qualifications and start talking about the job. Not the job on paper, not the job on textbooks, not the job in recruitment ads. The real job. The job that changes you, tests you, grows you, breaks you sometimes, that makes you proud in a way that nothing else ever has. This is the truth about nursing. So let's start with the part no one prepares you for. Nursing is emotional, not in a sad movie way, in a this is real life and it hits you in the chest way. So what it looks like is you will cry, and that's normal. Every nurse cries. In the toilet, in the staff room, in the car, in the shower, on the bus home, on their break, after their shift, before a shift. You cry because you're tired, you're overwhelmed, you're scared you made a mistake. You saw something traumatic, you lost a patient, a family member broke down. You felt helpless, you felt proud, you felt human. Crying isn't a weakness, it's release. You will see death, and it will change you. The first time you see someone die, you don't forget it. You remember the sound of the room, the look on their face, the family's reaction, the silence afterwards. You learn how fragile life is, how peaceful death can be, how unfair it can be, how beautiful it can be, how important your presence is. Nursing teaches you to sit with death, not fear it. And you will see pain, fear, confusion, delirium, dementia, trauma, grief. You will want to fix everything but can't. But you can comfort, and that matters. You will have favourite patients. You will have people you think about at home. You will have people you worry about. You will have people who remind you of your family. And when they decline, it does hurt. And there will be moments where you think, I can fix this. I don't know what to do, or I wish I could do more. And this is normal. Nursing is not about fixing everything. It's about caring through everything. Now let's talk about the physical side, because that's real. Your feet will hurt. 12-hour shifts, constant walking, constant standing, barely sitting. Your feet will scream at you. Your back will hurt. You will lift, support, turn, roll, hoist, bend, stretch. Even with perfect technique, it's physical. You will be exhausted. Not I stayed up late tired. Not I had a long day tired. I mean bone deep tired, brain fog tired. I can't feel my legs tired. I forgot my own name for a second tired. This is why nurses nap in their cars before driving home. You will skip meals. Not because you want to, because a patient needed you, a crisis happened, a fall occurred, a family needed support, a medication round ran late, a patient deteriorated. You learn to eat fast. You learn to hydrate when you can, and you learn to survive. You will get sick more often. You're exposed to flu, norovirus, COVID, chest infections, stomach bugs, everything. Your immune system becomes a warrior, but it does take time. Now let's talk about the culture, the good and the bad. Nurses are funny. Dark humor funny. You will hear jokes that would make the general public faint. It's not disrespect, it's coping. Dark humor is a survival tool. Nurses are protective. If you're new, the good ones will shield you, teach you, guide you, support you, and fight for you. Nursing is a family. Nurses are stressed, not because they're mean, because they're overworked, understaffed, exhausted, emotionally drained, carrying too much. You learn not to take things personally. Nurses are resilient. They cry, they wipe their face, they wash their hands, and they go back out there. It's incredible. And nurses are human. They make mistakes, they get overwhelmed, they get scared, they get frustrated, but they care deeply. Now, this is the part that hits the hardest. You are responsible for people's lives. That pressure is real, it's heavy, it's scary, but it also makes you grow. You must make decisions quickly. You learn to prioritize, escalate, assess, and act. You learn to trust your judgment. You must stay calm in chaos. A shift can go from calm to crisis in seconds. You learn to breathe, focus, move, think. This is where you become strong. You must handle conflict. You will deal with angry families, confused patients, stressed colleagues, tense situations. You learn communication skills you never knew that you actually needed. But there are moments that break you. These moments end up staying with you. Losing a patient you cared about, it hits like a punch. Seeing a family break down, you feel it in your chest. Feeling like you failed even when you didn't. Being overwhelmed and trying to hide it. Being short-staffed and feeling guilty for not doing more. These moments hurt, but they shape you. Moments that remind you why you chose this path. A patient saying thank you, it hits deeper than you expect. A family member hugging you, you feel the impact of your care. A patient improving because of you, you feel proud. A colleague saying good job, you feel seen. Realizing you saved someone's life, you never forget it, those moments stay with you. Nursing changes you. You become stronger, kinder, more confident, more resilient, more assertive, more emotionally intelligent, more compassionate, more capable. You become someone that you're proud of. Alright. Now we're going to talk about the pros and the cons of nursing. Not the fluffy ones you see on NHS recruitment posters, not the generic ones you hear in career talks. I'm talking about the real pros and the real cons. The stuff that makes people fall in love with nursing and the stuff that makes people walk away from it. And this is the truth. So let's start with the good, because there is a lot of good. Nursing is hard, but it's also one of the most meaningful careers in the world. So there are the pros that no one talks about properly. You will never be unemployed. Nurses are needed everywhere. Hospitals, GP surgeries, schools, prisons, community teams, mental health services, private clinics, research, education, care homes, military, cruise ships, remote work, triage lines, NHS 111. You have job security that most careers can only dream of. You can specialise endlessly. Nursing is not one job, it is 100 jobs under one umbrella. You can specialise in A&E, ICU, neonatal, oncology, mental health, community, theatres, paediatrics, district nursing, school nursing, GP nursing, palliative care, research, education, leadership, advanced practice, prescribing. You can reinvent your career every few years without ever leaving nursing. You get paid to train with the apprenticeship route. This is huge. You don't have a salary, pay no tuition fees, avoid student debt, gain experience early and build confidence faster. And you finish your training with a degree, an NMC pin, years of experience and zero debt. That's life-changing. You make a real difference. This is the part that keeps nurses going. You comfort people, you support families, you save lives, you ease suffering, you bring dignity, you bring calm, you bring hope. You matter every single day. You grow as a person, nursing changes you, you become stronger, kinder, more confident, resilient, assertive, more emotionally intelligent, more compassionate. You become someone you're proud of. You learn skills that transfer to real life. You learn communication, conflict management, time management, prioritization, emotional regulation, problem solving, crisis handling. These skills make you better in every part of life. You join a community. Nurses are a family. They support you, they teach you, they protect you, laugh with you, cry with you, stand with you. You are never alone. And you see the best of humanity. You see the strength, the love, the resilience, the courage, the kindness, the gratitude. It's beautiful. Now let's talk about the cons. The ones people hide, the ones colleges gloss over, the ones you only learn on the job. These are real, these matter, and you deserve to know them. The emotional toll is heavy. You will see death, trauma, grief, fear, confusion, pain. You will carry some of it home with you. You will need coping strategies. You will need support. You will need resilience. The physical toll is brutal. You will walk miles every shift. You will lift patients, support mobility, stand for hours, skip breaks, work nights, work weekends, work holidays. Your body will feel it. The workload is intense. Nursing is fast, busy, chaotic, unpredictable. You will juggle multiple patients, handle crises, manage time pressure, prioritize constantly. It's mentally exhausting. Staffing shortages are real. You will feel overwhelmed, stretched, rushed, guilty for not doing more. This is one of the hardest parts of the job. You will deal with difficult people, not just patients, sometimes families, sometimes colleagues. You will face anger, frustration, misunderstanding, stress, conflict. You learn to stay calm under pressure. You will make mistakes, not dangerous ones, but human ones. You will forget something, miscommunicate, misjudge the situation, feel embarrassed, feel guilty. Mistakes are a part of learning, but they hurt. You will question yourself. You will think, am I good enough? Can I handle this? What if I mess up? Is this the right career? Every nurse has these thoughts. You will see unfairness. You will see underfunding, burnout, inequality, system failures, bureaucracy, politics. It is frustrating. But let's go deeper, the stuff people whisper about but rarely say publicly. Some staff are burnt out and take it out on others. It's not personal, it's just exhaustion. Some patients can be rude or aggressive, not because they're bad people, but because they're scared or confused or in pain. You will sometimes feel underappreciated, you will give everything and feel invisible. You will sometimes feel unsafe, not physically, emotionally, you feel out of your depth. You will want to quit sometimes. Everyone hits that point. Now let's balance it, because nursing is not just hard, it's also one of the most meaningful careers in the world. You will save lives, literally. You will change lives, emotionally, physically, spiritually. You will be someone's safe space. A patient will trust you more than anyone else in the room. You will witness miracles, small ones, big ones, human ones. You will feel proud. Proud of your work, proud of your growth, proud of your strength. Now, despite the cons, despite the stress, despite the pressure, nurses stay because they care, they're strong, they're compassionate, resilient, they're needed, they're valued, they're proud. Nursing isn't just a job, it is a calling, it is a purpose, it is a privilege. Alright, let's put everything together. Here is the full realistic timeline of becoming a nurse in the UK without going to university full time. No fluff, no shortcuts, just the real path. Start the T-level course in health, that is 2 years. You learn anatomy, physiology, safeguarding, infection control, communication, professionalism and clinical skills. You complete 315 hours of placement, assignments, exams, employer-side project. You grow confidence, emotional intelligence, professional behaviour. This is your foundation. Then you get a healthcare support worker job. You work in real healthcare. You build experience, you learn the basics, you get paid, you build references, you build confidence. This is your foot in the door. Age 21, you get a nursing associate apprenticeship. You become a registered professional. You learn advanced skills, you rotate through placements, you study part-time, you work part-time, you build clinical judgment. This is where you become a real clinician. Then, age 23, 24, you get a registered nurse degree apprenticeship. You study nursing at a degree level, you rotate through every major area, you learn advanced clinical skills, handle real responsibility, and grow emotionally and professionally. This is where you become a nurse. Age 25, you qualify as a registered nurse. You get your NMC PIN, you become a fully registered nurse, you start your career, you choose your specialism, you build your future. This is the moment that everything pays off. So let's talk about what you should do right now if you want to follow this path. So, apply for the T-level in health. Look for good placement partnerships, good support systems, good teachers, good reputation. This is your launch pad. Start building experience early. You can volunteer, shadow, do short placements, help in community settings. Experience means confidence. Build your communication skills. Talk to elderly people, children, people with disabilities, people with anxiety, people who need patience. Communicating is half of nursing. Learn the basics of care. You can practice empathy, patience, listening, respect, dignity. These are the foundations of nursing. And prepare emotionally. Nursing is beautiful, it's hard, it's emotional, it's transformative. You need resilience, and you'll build it. Keep your long-term goal in mind. Your goal is T-level, HTSW, nursing associate, registered nurse. This is your ladder, this is your path, this is your future. If you're watching this because you want to become a nurse, I want you to hear this clearly. You can do this. You don't need to be perfect. You don't need to be the smartest person in the room. You don't need straight A's. You don't need to go to university full-time. You don't need to have everything figured out. You just need heart, determination, compassion, resilience, and a willingness to learn. Nursing is not about being perfect. It's about showing up. It's about caring. It's about being there when someone needs you most. And if you choose this path, this apprenticeship path, you will grow in ways that you can't even imagine. You will become stronger, kinder, more confident, more capable, more human. You will see things that break your heart. You will see things that heal it. You will see the worst of life and the best of it. And one day you will look at yourself in the mirror, wearing your uniform, holding your ID badge with your name and your NMC number on it, and you will think, I did it. I really did that. And you'll be proud. So proud. Because you earned it. Every step, every shift, every placement, every assignment, every moment. This is your journey. This is your future. This is your story. And it starts now.